No matter your age, you need to eat healthy and exercise, but sticking with it can be a challenge. The best plan of action would be to have an individualized program. Dr. Frederick Peters, founder and CEO of The Fitness Doctor, joins us today to motivate and inspire us to be the best we can be.
Thank you.
So you merge science and exercise, right? How does that work?
Right, so as you would imagine, personal training is important for people that want to get in better physical condition. The problem is nearly 50% of trainers aren't actually certified or degreed whatsoever. And so I actually have a PhD in the field of exercise physiology, and my goal is to bring a medical, scientific approach to exercise so that it's done correctly.
Okay, and what is a personalized approach for each of your clients?
So what I go through is a number of parameters, including EKG, spirometry, a whole host of measurements. I also look at medical history issues, relevant medical surgeries, to really create their personalized plan, because a lot of folks require that sort of specific attention, especially if they have chronic illnesses.
Okay, so what's your goal? Get them off of their meds and get them really healthy?
That's one of the goals for sure. I mean, weight loss is up there with the rest of those, but medications have lots of side effects. One of my primary goals is to make sure the patient sees good progress, and along with that sees a reduction in medications, because if they lose weight and their blood pressure goes down, you don't need those meds and you avoid those side effects. So that's a primary goal.
All right. And you've got some advice on cancer prevention, too.
Right. So as far as cancer is concerned, it's a very horrible disease. 95% of cancer is actually possibly preventable, with only 5% being hereditary. So as far as that 95% is concerned, roughly half of that could be modified through behavior, diet, exercise, getting more active. The other half through screening. My side of things is through exercise and diet. So what I like to do is increase people's activity level, get them eating healthier, nutritious foods that don't have, GMOs and aren't processed, and that really helps to abate and reduce your cancer risk, as well as prevent reoccurrence.
Okay, so don't get it in the first place, but if you do, get rid of it and keep it gone.
Keep it gone, exactly.
And you've got a story about a senior that you got back into good shape?
Yeah, so I have plenty of, seniors that I have as clients and patients. One in particular, she is just turning 80 this year.
Wow.
And she's seen a great reduction in her weight, improved range of motion. One of her big things was the ability to carry her trash bags from her home to her curb lawn, and she has a very long driveway. And she's able to carry those trash bags. She's very excited about that. So I really feel good when that happens, because it helps improve quality of life in those individuals, and her especially, she saw a lot of good progress. So
was one of your fitness activities carrying trash bags around?
No, but we have her lifting some heavy weights and some core work, and you'd be surprised, even if you're starting off at a very small level of endurance or ability, how quickly that progress does occur. And so when I see the transition, it makes it all worth it.
How long does it usually take to really see those benefits?
Well, it depends on your goal. So if weight loss is a goal of yours, roughly 1 to 2 pounds per week is the average weight loss reduction. Anything larger than that, I call it the biggest loser effect. You're likely to gain that back within a year. But as far as strength gains, that usually occurs over time. Usually about 6 months is the average patient in my facility. And so for progress and results, it's pretty quick, actually.
Yeah, 6 months out of your life to really make it better and to avoid potential diseases is nothing.
Yeah, and to modify your life in a way that provides a lifetime of improvement, and you take that with you going forward, it's really immeasurable.
All right. Yeah. Fantastic advice.
Thank you.
Jump to it, everybody. Make sure to feel your best at any age. My thanks to Frederick for joining us today. If you have questions, use the information that's coming up next to give the Fitness Doctor a call.
Find out more by calling the Fitness Doctor at 440-447-0347 or log on to thefitnessdoctors.com.